Good morning, Steamboat Springs. This is our second virtual town hall meeting that the City of Steamboat Springs and Routt County are sponsoring in conjunction with the Steamboat Pilot Today. I'm Lisa Schlichtman, the editor of the Steamboat Pilot Today, and I'll be moderating today's session. Our first panel focused on questions medically related, and today we're to answer questions around COVID-19 and the business resources available to employees and employers. And also we're looking at how we can maintain mental health during this challenging time. I do want to point out again that everyone is 6 feet apart because that is a key for us going forward. We should all be social distancing, and so we are modeling that here today. So I want to begin by introducing our panelists and just thank you all for being here. I know you all are very busy serving the community, so thank you for taking the time this morning. First of all, we have Jessica Voland, Regional Director for Workforce Development in Northwest Colorado. Next, we have Jennifer Dorr, Economic Security Supervisor with Routt County Human Services. Kara Stoller, CEO of the Steamboat Springs Chamber, and Whitney Bakarich, outpatient clinician with Mind Springs Health, Steamboat Springs. So we are now going to go through questions that have been submitted by members of the public. And so I'll just direct questions to each of you, and then when the first person answers, any of y'all can jump in and add your comments. So Kara, let's begin with you. With businesses having to adapt to the changing environment that we now, I guess, call COVID-19 normal, how is the Chamber evolving during this time?
So I wanted to start by thanking both the city and the county and you, Lisa, and the pilot for putting this on and having another avenue for us to convey all the work that's being done and all the support that's available. So thank you. In regards to the chamber, we have evolved. We are a traditional chamber of commerce. We are a economic development center, and we are the destination marketing organization for the community. And our role hasn't changed. We have been and will continue to be here to support businesses in the good and in the bad. There's, of course, a sense of incredible urgency, and we continue to research and understand and communicate and advocate for businesses going through this incredibly challenging time.
Thank you. Thank you for what you're doing. Jessica, I'm going to direct the next question to you. Many don't know that Colorado Workforce has an office right here in Steamboat Springs, and what can you guys do for people here in the community?
That's a great question. I feel like increasingly people are finding out that we are there because a lot of people come and banging on the windows. So we do have a workforce center here in Steamboat Springs. We also have a workforce center in Craig. Those offices are publicly funded, and they exist to help people who are looking for work find work and to help businesses find workers. Obviously, our mission continues, although the circumstances around that are changing rather dramatically. Our workforce centers are part of the State Department of Labor and Employment, which is also the state agency that houses unemployment insurance. And so while we are not the unemployment insurance office, we are able to help with some aspects of filing unemployment insurance claims. Most of the questions that we're fielding right now have to do with people who are filing for unemployment insurance and have some concerns or are getting stuck. And then also a lot of questions from employers about that same stripe of questions. If I'm not able to keep my workers on, what are my options? What's the best thing that I can do for my employees? Our office is physically closed to walk-in traffic, but we are fully staffed, and we are providing all of our services over the phone or virtually. And so folks can get in contact with us by calling the office or by emailing us.
Perfect. And you mentioned unemployment, and that is we're getting a lot of questions about that. So first of all, what requirements must be met for someone to be eligible for unemployment?
Right, so that's a great question. And I should preface all of this by saying right now there's a lot that's happening at the federal level. I think that there's hopes that another federal bill is going to pass today, potentially. And so every time federal legislation is being touched around coronavirus and the economic impacts, we're potentially seeing changes to unemployment insurance. And so what I'm saying is current for this moment, so far as I know. So in order to be eligible for unemployment insurance, you have to have, first of all, been an employee. That distinction is really important because if you are an independent contractor, like for example, if you drive for Uber or you're a self-employed employee, you might not be eligible for unemployment insurance. And so the first category here is to be an employee of an employer. And then the next category here is to, you have to have either lost your job or have your hours reduced below 32 hours a week in order to be eligible to file a claim. Hour reduction, it's important to know that if your hours have been cut because of this set of circumstances, you're also eligible to file. We're encouraging people to file as soon as they see that reduction in hours and or as soon as they have been let go. And then the other important criteria here is that in order to file a claim, you need to have earned at least $2,500 from your current employer in order to be eligible to receive unemployment insurance through them. There have been some changes to unemployment insurance recently as of last Friday. We are at the federal level and then the state reinforced getting rid of what's called a work search requirement. So traditionally, in order to receive UI, you have to be actively looking for work. That requirement is currently waived. The other thing that changed was a mandatory waiting period. We used to have a 1-week wait in place. That was where the state verified with employers that you had actually been let go. We have waived that in order to expedite payments as quickly as possible. Right now, the unemployment insurance system is being flooded with calls. That's been in the news quite a bit. Colorado had 180,000 filing attempts last week. About 28,000 of those went through. So that's about 15% of claims that were attempted to be filed were actually processed last week. The system is working rapidly on improving and enhancing capability in order to get more of those claims through more quickly, but it is taking some time. Right now, the best advice that we've been able to give, all unemployment insurance claims have to go through an online platform, and that's Colorado UI as an unemployment insurance.gov, G-O-V. That is the only way right now to file a claim. If you are unable to access that website or that website is being tricky for you, our advice is to get on early in the morning or after 8 p.m., so off-peak hours. The state is also moving to a gatekeeping system of sorts that is separating out what day you can file based off of your last name. All of that information is now available on the UI website, coloradoui.gov, but that is the only way to file a claim at present. Some folks, and the other piece of advice we've been giving is to hit save frequently throughout your application. The system will not auto-save your information, so you need to save it yourself. If you get to the end of the application and you don't get a claim number generated, there's no confirmation, contact our office. We're able to look up in the unemployment insurance system to see if your claim went through and to give you the claim number so that then you can manage your own claim. And so our staff are able to help provide some kind of ancillary support. Folks that do not have access to a computer whatsoever or have no internet access or lack the ability to apply online, there is a hotline. The hotline has been overwhelmed with calls. We had 100,000 calls last week. My staff are also able to help support filing a claim for somebody who doesn't have a computer or internet access. And again, the best way to manage that is to call our office. That's 879-3075, or you can email steamboat@state.co.us to be in touch with us.
Thank you.
Yeah.
Tons of good information. So let me shift over, Whitney, to you. Obviously, this time is extremely stressful on many levels. In particular, how can businesses, employers recently laid off employees who have lost their job maintain kind of a level mental state, a healthy mental state?
I think the first thing to focus in on is your basic needs. Are you sleeping? Are you drinking water? Are you eating regularly? Having some sort of routine is going to help keep you in your body, present to what you're doing. Exercise, make your bed every morning still, and practice breathing. And you need to practice your breathing when you're calm. So, kind of like when you go on the airplane, they always say put your mask on first before you help somebody else or a kid. So the first thing is to tune into what's going on inside of you and for you so that you can be calm, and then reach out and support others. And then if you're struggling, Mind Springs Health is still open. I can give you guys more information a little later on how to access all of our services, but reach out and then try to do something every day that you enjoy and don't feel guilty about that.
Are you all seeing an increase in people seeking support and help?
I'm not sure at my level. I maintain a caseload of 12 kids and their families. I'm currently reaching out to a few more that I had been working with before in my particular position, so I'm not sure what our office is looking like because I've moved more virtually to see all of my clients, but I would imagine so.
Absolutely, yeah. Very good, thank you. Let's see. Jennifer, you haven't gotten to speak yet, so I'm going to shift things around a bit. What would you say to individuals and families on federal assistance programs like food assistance, Medicaid programs, veteran services?
So as far as the services right now, nothing's changing. If you are currently on benefits, the state's kind of activated a thing where for food assistance and cash assistance programs, your redeterminations, if we hadn't received them to the office at this point, are going to be automatically auto-renewed for 6 months, up to 12 months, depending on the program. So if you can't get your redetermination paperwork into us for the months of March, April, and May, those are being auto-re-enrolled. So for the most part, I don't want folks to stress about being able to get their paperwork to the office, especially when we're not opening our Oak Creek and Hayden offices to the public. We're currently not open to the public. Our lobby is open at this time, where folks can pick up any kind of paperwork and they can come in and use the phone and call one of our caseworkers at any time to ask questions. But for the most part, services aren't changing. We're fully staffed. We're working every day, working on our cases just like we always are. We're taking, applications via, we do ask if people can utilize online, going to www.colorado.gov/PEAK, P-E-A-K, to apply for services if they don't have them already, or to update anything if they have changes in their income or changes in their household. Right now, that would be the best place to submit that to us.
Great, thank you. Let's see, Kara, let me shift to you. What resources are available for local businesses and employees? That's a big question, and probably a lot of you will want to answer that.
Yes,
But
definitely. It is a really big question, and we're all getting inundated with so much information that it can feel incredibly overwhelming. We've tried to take out that overwhelming piece. There's enough to be overwhelmed about right now. So if you go onto our website, steamboatchamber.com, there are links straight from the homepage where you can find additional resources, but I just wanted to take a minute to walk through a few of those. But again, all of this information is also referenced on our website. So first and foremost, reviewing the SBDC, the Small Business Development Center's Disaster Recovery and Continuity Guide. That's a great place to review, start putting a plan together, follow that path, and then connect with the local banks. I have had the opportunity to talk directly with almost all of the local bank presidents. They are financially strong. They have substantial liquidity and significant access to capital. They are also the first stop for any financial assistance regarding businesses. So there's a lot of discussion around the SBA loans. Need to work through local banks to be able to access those. That's the best way to go about that. And they are ready to support all of the local business owners as well as the residents individually. Next, I have also spoken with a number of the utility providers. YVA, the Mount Werner Water Association, City Water, all are ready to help support their both commercial and residential customers, but the customers need to reach out. and get on a plan, a payment plan. They have all, are not planning on doing any quick disconnects either. They want to keep everybody connected. With that, the state broadband office has requested that private ISPs, internet service providers, sign a pledge to not disconnect and also provide some leniency on bill payments. It's so important. We're referencing all this information that's available online so that people can stay connected and aware of what's going on locally, nationally, and around the world. I believe that Comcast has already signed that pledge, and I'm hoping that additional local service provider ISPs are signing that. The city council has approved to delay the February sales tax returns by 30 days, so those are now not due until April 20th. And along those same lines, the IRS deadlines for federal tax returns are now not due July 15th. So a little bit more runway to have some more time to focus on that in a couple months. The Governor Polis has made a request to property owners and landlords to, again, provide leniency on lease and rent payments, and also not invoke late fees and not evict quickly. We have been in touch with the city, and we're going to work to reach out to the local landlords and property owners to honor that as well. And then, not a resource yet, but I have been in touch with the State Insurance Commissioner, Michael Conway, as well as Senator Bennett and Representative Roberts, to discuss the inclusion of the impacts of COVID-19 on businesses and being able to be covered under business interruption insurance coverage. That's not through yet, but just want our community to know that I am working on that on their behalf. And again, all this information is on our website, steamboatchamber.com.
Thank you, Kara. Anyone else want to add about any other business resources that might be out there?
I'd like to add an update about unemployment insurance again.
Okay.
We're getting a lot of questions from businesses that are concerned about their premiums being increased or about their unemployment insurance accounts being fully tapped out because of the number of claims that are being filed. In a proclamation on Friday, Governor Polis mandated that unemployment insurance claims related to coronavirus are being considered a social charge, which means that the payout for those go against the state's trust fund. That's a $1.1 billion insurance fund that's maintained at the state level. They are not coming out of individual employer accounts, which is a huge relief to a lot of business owners. And it also means that it shouldn't negatively impact their premiums, the volume of unemployment insurance claims that are being filed right now. So that's some good news for employers. We've also been asked by a lot of businesses what's the best thing that they can do for their staff if they're anticipating that they're going to have to let folks go. My recommendation for those businesses that can sustain it is to cut hours first, because it takes some time for the unemployment insurance payments to come through. The state is trying to get up to a 10-day time frame to turn around payments, but right now it's 2 to 6 weeks. So if an employer has the capacity to keep somebody on payroll at reduced hours, but just to make sure that income is still going to that worker and delay the actual, full layoff of that staff person for some time, the worker is able to file unemployment insurance benefits immediately, and that gives them a little bit more of a time to have incoming in the door before the unemployment insurance payments do kick in the event that it does take, the average right now is 4 to 6 weeks. So we're working on expediting that, but that's some advice to employers. At the federal level, there was a lot that happened legislatively last week with respects to some options for emergency sick leave and expansions to FMLA, the Family Medical Leave Act. On an employer side, almost all of those provisions are contingent upon having enough cash on hand to continue to pay people now, either through sick leave or through use of FMLA, and then an ability to recoup those dollars through tax credits next year. And so for businesses that do have those margins or have enough cash on hand right now to do that, there's some federal provisions in place to make that a lot easier. Unfortunately, the majority of small businesses don't even have a full month's worth of operating expenses to cover. So, that's not necessarily a solution for everyone. But for those employers that do have that option, they should look into the new expanded emergency sick leave and emergency family medical leave act at a federal level.
Thank you. Anyone else have anything else to add on that note? Okay. Let's see. Jennifer, for those who haven't had to use an assistance program of any kind ever, how, and I'm sure there's some that are experiencing that for the first time, how do they go about it? How do they find out information?
So our office is still answering questions. So anybody who would like to speak with somebody in person can call our, we called it our Tech of the Day line. It's for our on-call caseworker, and that number is 870-5280. And that's a number you can call and talk to a person at any time. If our business practices change, you can leave a message, and we will be able to contact someone within that same day offsite, which we'll be grabbing voicemails if that were the case. But we can always answer questions if you just want to know, what are income limits or what are, what's available. Right now in our office, we offer cash assistance for families and for expecting mothers. We offer cash assistance for elderly and disabled folks. We have food assistance, obviously, and medical assistance. If you're right now with everybody with job loss and such, we do. The state of Colorado kind of expanded the Colorado Works program, which is a cash assistance program for families, and within that, it kind of raised the income limit. So we have $75,000 annually, which means about $6,250 per month gross for a family with children or with an expectant mother. So that's something that can help folks get through some tough times. If you're looking at food assistance, we look at 130% of the federal poverty level. So for one person in the home, the gross limit is $1,354. For two people, it's $1,832.
Is that a month?
That's per month.
Per
Yeah.
month.
Sorry about that. And then for Medicaid, the income limits are changing as of April 1st. That's just something that happens every year. So right now, for one person in the home per month, gross, it's $1,385. As of April 1st, it'll be $1,415. And then that goes up with however many people are in your home. So I would suggest if you would like to just get your application started, to go on to colorado.gov/peak, get your application in. We can, if you do not have an EBT card already in your possession, we can get one sent via mail immediately. So that takes about 7 days to get to someone. It does come from Colorado, from Denver. So we want to do that as soon as we see your application and get that going. If you want to email a question, we're getting to quicker, obviously, right now. We have a main email that anybody, when they email, it's our on-call case manager. So it's DHS-FAMED. So it's DHS, food assistance, medical. So dhsfamed@co.routt.co.us. And that's on our website as well, on Routt County. And you can email any questions. You can email documents that you need to get in. Take a picture with your cell phone. We're pretty lenient on how we're getting our information right now. So, yeah, I'm trying to think what other options we have. We are taking documents into our Dropbox outside of our building. You can come in and grab an application right now while the lobby's still open. And we pick up documents out of the Dropbox multiple times per day. So we're keeping an eye on that. Yeah.
Thank you. Jessica, anything, I know I've been reading and hearing, there's a lot of people that are unemployed for the first time ever in their lives. So any suggestions you have for someone who might just not even know where to start?
Sure. And it's a challenging time, obviously, because the information is so bogged down. Everybody's needing to utilize it all at once. Again, that's where, my staff are available to help answer whatever questions we can. The UI website is going to be the best place to go. One thing I would say that is unique about unemployment insurance is that all of us pay into it all throughout our working lives. So it's a little bit different because it is an insurance scheme. And so businesses pay into it for their workers, and we also pay into it as employees. And so I would encourage, anyone who's maybe feeling hesitancy about filing for this should not, because they've been contributing to it throughout their entire professional experience. It's there for these types of situations. I did want to say unemployment insurance payments will reimburse about 55% of your gross wages up to a maximum of roughly $600 a week. And so there is a benefit calculator on the UI website where you can input your earnings over the last 18 months, and it will give you an estimate of what your unemployment insurance benefit amount is going to be. At a max of roughly $600 per week, we know that for lots of folks, it's not getting close to replacing the kind of earnings that they might be used to getting through their jobs. And so it's certainly a stopgap measure. We also know that at the federal level, they're working towards cash payments. So issuing checks to people below a certain income level, hopefully that is part of the bill that gets passed today. That's the intention anyway. So in addition to unemployment insurance, some immediate cash injection to workers underneath a certain income level should help with providing some coverage for these really uncertain times. One thing, with respect to the unemployment insurance process too, that I did want to add is that typically UI pays out for 26 weeks. Federal legislation last week has extended that now to 39 weeks. So important to know that, we're trying to loosen the mechanisms and make it easier for people to apply, easier for them to receive that benefit for a longer duration, just because the times are so unpredictable right now.
Great. Whitney, let's talk a little bit about what mental health resources are available for the community.
Yep, so Mind Springs Health is the community health organization here. We serve actually all 10 counties, so essentially the whole northwest quadrant of the state. All of our outpatient offices are moving towards being virtual. So we are seeing clients through Zoom or by phone if they don't have internet access. Our West Springs Hospital in Grand Junction, which is the only inpatient mental health facility in between Denver and Grand Junction, is still open, still seeing people. We are still taking new patients. All of the intake paperwork can be found on the website, which is mindspringshealth.org. We are also still doing psychiatry appointments and med management for any community member who needs that. We still take all insurances, Medicaid, we still have our sliding fee, so none of that has changed, just the way that you access it. In order to start services, you still call our Steamboat Springs office, which is 970-879-2141. We also man a crisis line. So if anybody is experiencing a mental health crisis, they can still call the statewide crisis line, which is 877-866-8192, or text TALK to 38255. That is routed to the state line, but then it gets it to a local live breathing human being here in our community that is always on call. And we can still see people, again, virtually through Zoom or on the phone. Our Mind Springs Health website is also has a lot of great resources on it. If you go to mindspringshealth.org/COVID-19, it gives you a whole page of how to access. They've been uploading like different guided meditations and coping skills. There's also a link to, it's called My Strength. It's an app that you can download on your phone to give you different ideas for self-care or coping or guided meditations, just different ways, you can think about things during this time. And then there is a code that you can enter, again, to access the My Strength app, and the code is Wellness Web, and all of that information is listed on the Mind Springs Health website. Mind Springs Health is also doing a bunch of different Facebook Live events through their Facebook page on various topics of how to take care of yourself, how to stay optimistic, how to keep your prefrontal cortex online, which is all of our planning, decision-making, rational thinking. Because in situations like this, the more primitive parts of our brains start to take over. And so we need to be able to access the front part of our brains to continue to make logical decisions and respond to things rather than get into just a pure state of reaction. So all of those things are there to access. All of our clinicians are still here. We have our case managers that are still here to help people access and navigate the different wide variety of resources. I think I'm being inundated by my mailbox by all of our community partners still communicating, so we're still talking with the schools, the health partnership, any type of entity that somebody needs to be connected to, we're also still maintaining our network of our professionals to be able to connect people with whatever resources they might need to. So we can also be a resource to help people and direct them to the different places. So I think that's all I have about how to access them. We're still here, still doing it.
Fantastic,
Yep.
okay. I might add too, I know there is a group, the recovery community, I know can be vulnerable at this time, and I know there's a sober Steamboat group, and I know AA and NA will have online meetings, so I do want to mention that as well. Let's see, anyone else have anything on the mental health aspect of resources? I think you covered it well, and it's actually great to know that there's so much out there to help people. Jennifer, is there anything else as far as social services that you all can offer through the Routt County Department of Human Services?
So we have another fund, it's called Community Service Block Grant, and that is another program that can help folks pay for, emergent housing assistance payments. We pay directly to the provider, so if we are in a situation where you're being evicted or you have utility bills that are a month overdue, we do have some funds there that we can help pay those. Emergency medical, if you don't have medical coverage, dental, things like that, we do have a fund for that. The state's looking at expanding it, so we're fingers crossed hoping they do. And then, again, the different cash assistance programs may help out quite a bit right now if folks are experiencing job loss or income loss. Food assistance can help, if you're within those guidelines, it can help supplement what what you do have at this point. I would definitely visit, our website for Human Services does have a list of the different programs. Colorado.gov, if you go into, I think it's state agencies, you can see all the different programs we offer within Medicaid and within food assistance and cash assistance. And they've got a lot of information online to visit. Like I said, right now our lobby's open, so you're welcome to come in. We have all the applications sitting out and ready, and you can always call on the lobby phone to someone, and we can go over different programs that might be suited for that family. So we're definitely, we definitely like, getting in there and trying to find out what we could get going and what resources we know of in the community. Dialing 211 gives you an information base of resources outside of our office that can be helpful if you're not eligible for programs under our income limits. That can get you, connected to all sorts of different ones in the community, and there are quite a few. So they've kind of got it figured out between housing and employment, and I'm trying to think of all the different areas, transportation, all sorts of those. So there's definitely a lot of resources out there.
Great, thank you. Next question, Jessica, is anyone currently hiring? And maybe Kara also may know this.
Yes. So
Good.
a couple of different ways to get after this information. So the state maintains something like a monster, Indeed.com, but it's just for the state of Colorado, and that's connectingcolorado.com is the website to go to. If you are working from home or in the habit of working from home, or you'd like to start working from home, we have over 13,000 location-neutral jobs in that database. You can find those by typing neutral in the location box in the search field. So that's a great way to find out what type of remote jobs might be available inside of the state. And then locally, as you might imagine, most of, we have this very uneven distribution in terms of some people are shedding services and some people are really having to ramp up. So obviously, the grocery stores, food delivery systems, gas stations, Casey's Pond is hiring right now. They have open positions specifically in their kitchen, hospital, healthcare. So, if you can think about what type of businesses locally might be experiencing higher than average demand, that's a great place to start. You can search on our website for those local jobs at connectingcolorado.com. You can also call or email our office to get a current list of all of the local businesses that are hiring. And then, looking at those individual employer websites or contacting their HR departments is also a great way to get good, up-to-date information about the businesses that are hiring. I should say that certainly national chains and franchises, folks, like King Soopers, who oversees City Market and Walmart, are offering signing bonuses. They're increasing their minimum wage rates right now because they have such a high need of workers. And so there's some really unique opportunities in the labor force right now, compared to what unemployment insurance is able to offer, that 5,500 or 55% of your salary a week up to $600. If you can find a job where you're now able to get, $16, $18, $20 an hour, probably going to put you financially in a better position than just relying on unemployment insurance. So yes, employers are still hiring, but as we know, as kind of these rolling closures take effect, that picture changes day to day. So my recommendation and what we encourage folks who are contacting us to do is to really focus on those critical services that we know even in states that are maybe a little bit further down the line in terms of impacts, have not shuttered their doors. So grocery stores, gas stations, delivery services, those types of businesses are likely to experience increased demand and need workers now.
The only addition that I would make is that because it is so, there's so much information available, that we are also encouraging both people who are looking for employment and employers who would like to list available jobs to work through the Colorado Workforce Center. So that's the main hub, and we're not sending people to many different areas to hunt down what's available.
And I would be remiss if I also didn't say the Steamboat Pilot and Today Classified also has quite a few job listings, so thank you. That's good news, thanks. So Whitney, and really, probably anyone could answer this, but what could people be doing to help themselves, their family, their neighbors, who might be suffering and struggling to cope a little bit right now? What would you suggest?
I have lots of suggestions. So again, the first thing I think is really to focus back in on your basic needs. Are you sleeping? Are you eating throughout the day and eating healthy foods? I know I have a tendency at home when I'm at home to drink an entire pot of coffee. That's going to increase your anxiety. So try to limit your caffeine use. With people, moving to work from home, try to create a space in your house that's just for work. Try not to work in your bed. Try to keep your bed just for sleeping, because you're going to be able to have better sleep habits if you're able to do that. Move your body every day. Our bodies can get really stiff if we're spending too much time on the couch, even for a couple of days. So make sure you're getting out, maintaining your social distance, but getting fresh air. It's a really interesting time, I think, right now, because there's so much dissonance going on in that, on one hand, everything is being thrown at us so fast, and yet, on the other hand, life is slowing down so much. So really trying to take time in those spaces where, I think I have a list of all of the things I want to do when I have time. So now you have time for those things. So try and think about what you can fill your time with. What have you been putting off? What are things you can still be grateful for? I don't know how many years I'm going to be able to watch, the world change into spring and have all of, I'm starting to see little flower buds pop up everywhere. So just take time to notice those things. Take time to maybe savor a memory or something that makes you feel good, because we are being thrown so much of this information that is really scary right now. And we can still experience the things in life that are good. Nurture your relationships. So whether that is calling or sharing recipes or setting up virtual play dates, try to keep connected with the people you love, and maybe reach out to people that you aren't as close with anymore to maintain those social connections. Try to be kind to others, especially, when our capacities are getting towards their top, we don't have a lot of space for things, but that is the most important time to be kind to ourselves and then to other people. When you are out and about, it's okay to smile to people still. It's okay to acknowledge them, to make eye contact. And, breathing. Our brains are connected to our bodies, even though we like to think that they aren't sometimes. And you can actually slow your heart rate down by slowing your breathing. So if you feel like you're getting into that panic state, you can just tune into your breath, slow it down. It'll calm your heart rate. It'll get your thinking brain back online. Probably one of the most important things is try to limit the time you're watching the news. so that take breaks from the news. Come back to it when you have to, but try not to let that be your whole life right now. You're still so many other things than this infection that we have going on. Again, while at home, takes time every day to do something that you enjoy. Take time to play with your kids. You know, they're going to be around you a lot more, so take that 5 minutes to connect with them. And also something to note for kids and for us is that you might see in your kids things that you haven't seen in a while. So there might be some regressed behaviors. Kids might not be able to tell you that they are hurting or scared. They might not have that vocabulary, so they might be coming to you with more headaches, more tummy aches. So it's okay to have Band-Aids on hand and to stick Band-Aids all over your kids. They might need that right now. And then just to, you know, be gentle with yourself and, yeah, drink water, eat, sleep. I think that's about all I had.
Thank you. Thank you. We're kind of drawing to an end. 2 more questions. One kind of more general. Are there any other resources out there that we haven't mentioned so far that any of you all can think of?
Again, we've tried to cull all that information and then put it in one place on our website because you can go down entirely too many rabbit holes right now. So I would really encourage people to visit steamboatchamber.com. Both employer and employee resources are listed on there. And if I could just jump back and tag on to Whitney and her recommendations in terms of business owners right now, it is paralyzing. And we can get in a very reactive state, again, as Whitney had mentioned. And I would encourage, certainly, again, business owners, but everyone to see what they can do in being proactive. For businesses, we do have that disaster recovery and continuity guideline. You can take it and follow it. It's a path that's set forward, but it will help you be proactive. And how can we be proactive in being kind to each other?
Very good, thanks. Anything on those lines that you all would like to add?
I just want folks not to worry about any social stigmas coming into our office. If they have concerns, you know, a lot of folks are having trouble with this first time they've ever needed assistance. There's no stigma to it. This is unprecedented times. We have, you know, programs here that are here for a reason. They're here for emergencies. So if you have any questions, if you're, you know, feeling anxious about calling, please don't. We're here to help you through situations, talk you through, see what we have available, and if we don't, we have a list of resources that we all have in front of us that we love to get people situated with. So don't let any kind of, you know, personal stigma or personal feelings stop you from reaching out and helping your family and yourself during this time.
Thank you.
I agree with all of those comments. There are a couple of other things that don't fall underneath any one of our particular wheelhouses that I thought I would mention that came out of the federal legislation last week. There's been a suspension of any foreclosures for 2 months on FHA loans. Governor Polis has encouraged all private lenders to replicate that particular model in the state, so that's good news for people who are struggling to pay their mortgage right now. Federal student loan payments, the interest rates have been set to 0 for the next 60 days. There's an option to suspend your student loan payments if they are federal student loans for the next 2 months. And again, they're working on trying to get private lenders to replicate that same thing. I think Kara mentioned this, but the governor has requested a 90-day deferment of pay on all commercial and personal loans, and that property owners and landlords defer those payments and waive all late fees. Right now, that's a request, not a requirement, but the governor does, you know, have a capacity, at least within public funding entities, to go ahead and make that permanently effective. Many of these things I think we're hoping will be part of the federal legislation package that's estimated right now, you know, somewhere between $1 and $2 trillion that should hopefully be passing today or tomorrow. There should be a lot of relief measures in there for businesses and for impacted workers. And I know that, you know, the average person doesn't really have the bandwidth to digest what's in there and figure out, you know, what does this mean for me and how does this apply? But of course, it's really important that we start to untangle those things and understand what relief mechanisms are there and how are people learning about those, so that it does decrease some of the anxiety and the worry that everybody is experiencing right now. So I think, knowing that those changes are evolving and, they're happening frequently, and folks like you guys are doing a good job of trying to keep people informed locally on what does this look like and what does it mean, is going to be really critical. And I think the biggest relief is going to come from a federal level, because this is impacting the entire country. It's not just, Routt County or Steamboat Springs. And something too that I wanted to share, our offices, we're used to seeing people come in an individual crisis of unemployment often, right? That's what we do. People come in and have been let go, and they're going through all of these issues kind of in isolation. How am I going to feed my kids? How am I going to pay my rent? How am I going to find work again? Right now, because this is happening at scale, there's so many more systems and supports and responsiveness than was ever previously taking place. Like 2 weeks ago, if you got let go from your job, you could file for unemployment insurance. Hopefully you'd get some payment in 6 weeks. You had to, be looking for work. You only had 6 months to get it. You may or may not be eligible for some of the assistance programs available through Human Services. And that was kind of it. And now, because the volume of this crisis is so significant, people are pulling out all of the stops, and we have more resources and more capacity to address these issues today than we have ever had previously. And I know that for people who are individually experiencing loss of a job or uncertainty, that individual crisis is still very real. But I am bolstered by the fact that the system has more capacity to respond today than we have ever had at any time in my lifetime. And what I am hopeful for going forward, as we come out of this crisis, is that some of these mechanisms and structures that are being built right now, we should have had them in place a month ago or 6 months ago or 10 years ago, and we didn't. And so I think that there is some hope to think about, ways in which the economy hasn't been structured in a way to work well for everyone for some time. It maybe took something of this scale to get us to a place of course correction, and hopefully in the future, we are much better equipped to handle the individual layoff or the individual family crisis, because we are experiencing this collectively now. And so I think, that would be my silver lining from my vantage point.
Yeah, thank you.
Sure.
Last question for you all. What, and maybe we start with Kara, how can the community support local businesses right now?
Yes, that is tricky of, what can you do? I know that there's more on the community side and supporting your neighbor side. There's a lot of efforts underway right now, but it's how do you do it in a safe, healthy manner? Same goes for supporting businesses. I have a few ideas, though, to get people going again. How can you be proactive? What's one proactive thing our community members can do a day? You can still order online, so keep that going. Buying gift cards is a really great way to support local businesses right now. Giving businesses reviews online. That will help them. It helps them now in their positive mindset, but also down the road when we're getting back to normal. Sign up for their emails, connect via social media. I think the biggest thing is to make sure that we are still communicating as much as possible so that we have those both social connections, but also the business connections.
Great ideas. Very good. I think we will close. I'd like to give you guys each an opportunity to say something that maybe you didn't get to touch on, a question we didn't ask. So, Whitney, I'll start with you. If there's anything else you'd like to say to our virtual audience.
I think if you're struggling, reach out. Like I said, Mind Springs Health is still here. We're still serving all of our people, and we'll make it easy if you haven't sought services before to make that happen. And maybe people who haven't reached out for mental health services before will feel more comfortable doing that, because I know it can be kind of scary sometimes to walk into a lobby and say you need help, which it shouldn't be because we're just like a doctor's office. But yeah, if you need it, we're here. Ask. We'll get you what you need.
Thank you. Yep. Kara.
I just would reiterate Jessica and her comments about federal legislation that's coming down that will make a massive difference for our ability to get out on the other side of this. There's also state resources and guidance that's being put into place. But I have been just overwhelmed with the amount of local effort that's been put into place to help keep our community safe, help support each other, and then also start planning. What's our road to recovery? That work is underway as part of one of the ESF functions led by the county right now, and John Bristol, our Economic Development Director, is leading that support function. So I want our community to know that there are so many people working incredibly hard to provide the resources at all different levels and to help us get through this together.
Thank you. Jennifer.
I just want to reiterate, coming to our office, even if you have questions, not coming to the office, calling our office, emailing, visiting online. But, even if you had received a denial just recently, there's so many changes to the programs, daily, it seems like right now, where your eligibility situation can change. Reach out to our office, call, email, whatever, if you want to find out if there's been any changes, if they might be eligible now. Maybe their hours were cut in the beginning and now maybe the income's gone. Reapply. If, it's okay if we get an application again a month later or a couple weeks later. If your situation has changed, get in here, get on. There's so many programs available. I don't want anyone to be sitting back questioning whether if they should or they shouldn't. I'd rather them just get it out there. If they get a denial, at least, you've got that first part put in. It's always easier to reapply once you've submitted one in the first place. Our staff is a group of very warm, caring gals that are they love their jobs and they do a fantastic job. I don't think, anybody should worry about, speaking with someone who's going to be rude or, there's a lot of stigma that's even with the county office. We just have a great staff. The girls are super passionate about what they do. I hope folks reach out.
Thank you. Jessica.
Well, I think, for me, the thing that we keep reiterating is how unprecedented this is. And from an economic standpoint, we've never had a self-engineered recession, which is what's happening right now, right? This is something that we are choosing to do to balance against the health risks of not taking these actions that are really kind of grinding our economy to a halt. And I think that it's important to recognize that this is unprecedented and to have a measure of, grace and patience with ourselves and with other people because nobody has ever navigated anything like this before. And that feeling is going to persist over time until we come out on the other side of this. And so, I think that I don't like the phrase social distancing, even though we all seem to have adopted it. I think physical distancing is better and social closeness is really important right now. And so, whether that is, you're used to ordering pizza from Brooklands and maybe you call and say, be friendly when you call and order your takeout and how are you guys doing? Or if that's a neighbor or if it's somebody on Facebook that you haven't talked to in years. I think that those social connections are so critically important right now because everybody is feeling this unprecedented level of panic and worry. And nobody has a crystal ball on exactly when it's going to resolve or what it looks like on the other side. And so, I think that we need to kind of hold on to that and be extra gentle with ourselves and each other, in reacting to what's taking place is, as Whitney says, take a breath and, you're only in the moment that you're in and you can't worry your way out of it, right? And so we need to, I think, I'll be mindful of that and to display sort of a above and beyond level of kindness and compassion for ourselves and for the people around us. I am really encouraged by, somebody who's worked for government my entire life, the scale and the scope and the quickness of the government response really, bolsters my sense of there are the right people and institutions and efforts being made to try to shore this situation up as best as we possibly can. And, my own vantage point on that is that it's the right actions are being taken in the right time frame. And I think that we're going to weather this okay. We don't know what it's going to look like on the other side, but I think, economically and looking at businesses and workers, people are going to get through it and the right supports and systems are there. People just have to access it. And if you can't get through the first time you try to access it, don't give up, don't get frustrated, keep trying and keep reaching out. So.
Thank you all so very much. I hope those that watched this morning are encouraged just by the nature of each one of you being in the positions that you are in this community. And I think I'm grateful that I'm experiencing this here in Steamboat Springs and Routt County, because we are stronger together, even though we're a little bit apart right now. So again, thank you, and you guys are perfect examples of that. So I hope everyone has a great rest of their day. Thank you for tuning in.
Thank you.